You are invited to take part in a research study. Please read this information and feel free to ask any questions before you agree to take part in the study. Granulation tissue is a frequent complication following the placement of gastrostomy tubes and gastrostomy buttons that turn into granulomas, with as many as 72% experiencing granuloma formation within 3 months of placement. Current treatment given for these granulomas are silver nitrate, steroid creams, stum adhesive powder, topical antibiotics, and salt. Each treatment has shown to be effective, but there have been no studies comparing all these treatments. The purpose of this study is to compare two treatments, silver nitrate and table salt, that are each used for patients that develop granulomas after a gastrostomy procedure. After you have decided to participate in this study and have signed this document, you will be assigned to one of two treatment study groups. Group 1 will use sprinkled salt applied to your gastrostomy lesion, and Group 2 will use silver nitrate therapy. As standard of care, discharge instructions will be provided for each group, and you will see a video for home reference. For Group 1, table salt group. Table salt applied to the granuloma, sprinkling 1/3 of a teaspoon of salt to the granuloma site once daily for 7 days. This will be applied by the research staff initially in clinic, and you will continue every day from day 2 to day 7 at home. On day 7, research staff will evaluate your granuloma lesion and take a picture using a measuring device in the research center. On day 7 of the study, you will be asked to complete a survey about treatment satisfaction for your granuloma care. For Group 2, silver nitrate group. Day 1, research staff will evaluate your granuloma lesion, take a picture using a measuring device, and apply silver nitrate. Day 4, you will go to the research center. Research staff will apply silver nitrate to your granuloma lesion and obtain photographs of the lesion. Day 7, you will return for the final time to the research center. Research staff will evaluate your granuloma lesion, and take a picture using a measuring device and apply silver nitrate. On day 7 of the study, you will be asked to complete a survey about treatment satisfaction for your granuloma care. Potential risks and discomforts. For study Group 2, silver nitrate arm, your child may experience pain, redness, skin burns, and/or blisters during and after application of the silver nitrate. While unlikely due to the use of topical or stick applicators, there does exist a small risk for dizziness, headache, nausea if fumes are inhaled. By comparison, salt has a limited risk profile, include mild burning or irritation at the site of application. Potential benefits. You will receive no direct benefit from your participation in this study. You will not be paid or compensated in any way for this study. However, your participation may help the investigators better understand better treatment options for gastrostomy granulomas. Alternatives. The following alternative procedures or treatments are available if you choose not to participate in this study: the use of silver nitrate, steroid creams, stum adhesive powder, topical antibiotics, and salt. You have the option of not participating in this study. Investigator withdrawal of subject from a study. The investigator or sponsor may decide to stop you from taking part in this study at any time. You could be removed from the study for reasons related only to you, for example, if you move to another city, if you do not take your study medication, or if you have a serious reaction to your study medication, or because the entire study is stopped. The sponsor, investigator, Food and Drug Administration, or Institutional Review Board may stop the study at any time. You will not be paid for taking part in this study.